Okay, here is our quick overview of a few of our vascular disorders. So in this short video, we're going to talk about peripheral arterial disease, aneurysm, and aortic dissection. Now, your share path has some great lessons on these vascular disorders, as well as like DVT. And that is another one that I encourage you to really kind of concentrate on because we do see that a lot in practice. So this is some of our different stages and symptoms that go along with each stage for peripheral arterial disease. So often you're going to see patients that may be asymptomatic, but when you do your assessment, you may notice that they've got decreased or absent pulses. In this stage, a lot of times what you might see are just some of these general symptoms, and some of your clients may not even be aware that they have peripheral arterial disease. So this is something that you'll sometimes pick up on and want to be aware of just based on, your assessment that you have. And then as this progresses, you'll see what's called like intermittent claudication, which is pain that they will complain about. And so oftentimes this pain will occur with activity and go away with rest. And then it progresses to where they have this pain that wakes them at night. It occurs even at rest. It may have more like aching, numbness. And then as it progresses, they'll even end up with wounds that can be necrotic. So you'll see that black where actual cell death has occurred. And you'll see those ulcers or black tissues on, toes, forefoot, and heel. With gangrene, you'll see an odor. And so sometimes if this progresses to like necrosis or gangrene, patients will even end up with amputations. So it is important that you do assess for patients that may be at risk for this. Risk factors include tobacco use, diabetes, hyperlipidemia, and hypertension. You also want to listen to if they have any type of family history, if they have a sedentary lifestyle. And then again, do all of these kind of physical assessments that we have talked about. Now, some of your priority lab tests and diagnosis will be that C-reactive protein that will look for inflammation, our serum lipid levels. You'll see Doppler studies ordered for these patients to actually look at blood flow. And then we'll be assessing like fasting blood glucose or hemoglobin A1C, that glycosylated hemoglobin. That gives us a picture of how blood sugar has been over time, and we want that definitely under 7. And then we might also see arteriograms ordered. Arteriograms are when dye is injected into the vascular system to assess blood flow, and then anchial brachial index. Those two diagnostics will help us understand the severity of it. This is something we did mention in class, and so you definitely do want to be aware of the 6 Ps and always be assessing for this with your patients that have peripheral artery disease. And then some of our interventions that we're going to do are risk factor modifications, so smoking cessation, controlling hypertension, diabetes, controlling our lipid levels with diet and medication. We might be helping our clients with exercise, weight reduction, dietary modifications. And then we do want to make sure that they are aware of good foot care. And so the foot care that we want to promote is keeping feet clean and dry, using a mild soap, room temperature water. They may have lack of sensation, so we want to avoid they can get burns because they may not actually be able to feel that hot water temperature. Keep feet dry. Make sure even like in between the toes is kept dry, avoiding injury. So encourage them to wear comfortable, well-fitting shoes. They should never be going barefoot. They need to keep their toenails clean and filed and not be trying to cut their toenails if they cannot see them, and they need to be cut straight across, not down in the corners. So sometimes older patients are not able to do this safely, or their caregivers, so they may need to be seen by like podiatry. They can keep some lotion to keep their, if they have dry skin, but you want to make sure and think about safety with this. So you want to make sure, again, that they're not walking around barefoot with lotion on the bottom of their feet. Prevent that exposure to extreme heat or cold. Again, no heating pads because they may not be able to feel this. And looking daily for any injuries that they may not be aware of. And then reporting any type of sores or injury that they have. Complications would be those ulcerations, wounds, sepsis from infections that they may get, gangrene, and just that ischemia or tissue injury. And again, they may end up with amputations due to gangrene and necrosis that they may have. So as a nurse, if you have a patient with peripheral artery disease, you want to be doing good assessment of the extremities, look at in between the toes, check the heels, bottom of the feet, so that we can detect any changes early on, good skin care promotion, good positioning of our patients. We want to make sure that they're not crossing their legs, bending the knees and crossing the legs. That can cut off blood flow. And then helping them managing pain. Our priority medications are going to be antiplatelets, so it may just be aspirin. And with that, they need to watch for bleeding. They may have like Plavix. So any of those antiplatelet agents. And then our education is going to be, again, good foot care, and any teaching about diet modification, medications, pain management that we may have. And then this comes right from your book, but I thought it did a good job of kind of summarizing things that you need to be aware of, and this can help guide your education at home. And it's things that we can teach about assessing for good tissue perfusion, depending on what their treatment is, that they have knowledge of treatment, knowledge of good wound care, how to prevent any type of injury, coping, and then any safety hazards that may be present in the home and how to avoid falls. Went ahead and put thrombolytics in here because I did not pull this up. Thrombolytics are used anytime there is a clot that's actually occluding the vascular space. So this can be, they're used with an MI that's caused by a clot. It could be if there is a clot in the peripheral system, but these are our clot busters. So since I didn't add it when we talked about MI, I mentioned the clot busters, but I thought this was a good visual, so I wanted to add this here. Now, clot busters are never going to be used if we are worried about like an aneurysm or an aortic dissection, anything that we think might lead to bleeding. So let's move on and kind of shift gears into aneurysms. And really what your book really concentrates on is abdominal aortic aneurysms. You'll hear them called AAA. And this is just a quick overview of some of the signs and symptoms that patients will complain of. Remember, if there's a pulsating feeling in the abdomen, or you notice that, we don't want to be palpating that, because if this aneurysm ruptures, it is a life-threatening medical emergency, because they are going to lose a lot of blood quickly and have large amount of internal bleeding. So this is something, that again, it's a medical emergency that's caused when that weakened vessel ruptures. And in the case of the aorta, it can be anywhere as the aorta exits the heart down through the abdomen. And again, it is life-threatening. Aortic dissection is a little bit different because this is a tear. And again, it can be anywhere from where it exits the heart down through the abdomen. And so the blood may not be going into the abdominal cavity, but it actually, because of this tears in the wall of the aorta, you can get a large amount of bleeding in kind of the linings of the aorta. And again, this is a medical emergency. They may be getting some blood flow through the aorta, but it is life-threatening because they're also using a large amount into this lining of the artery. And so again, this is a medical emergency, whether it's the abdominal aortic aneurysm. If it is a small aneurysm, our goal is going to be to try to prevent that from rupturing. And so that would be anything that we can, controlling hypertension. With any of these, that are at risk for rupture or dissection, they're going to be surgically repaired because, again, these can be life-threatening. So again, review those lessons in your ebook. If you've not already done so, here is an example of where the lessons are located. Here's the one on peripheral arterial disease. This will also, we didn't mention this in this video, we'll talk about venous insufficiency because you will see a little bit difference in how these look with your clients. But they can also cause lung ulcers. And then here is the lesson on venous thromboembolism. If you have read it in your ebook, you may not choose to watch this lesson, but I just wanted to make students be aware of that, you want to feel comfortable with how to assess and care for patients with venous thromboembolism, or you'll hear it called DVT, as well as those venous ulcerations as well. All right, let me know if you have any other questions. Have a wonderful day.